Hello everybody and welcome to the Tuesday edition of Video Clips. Just a couple of quick announcements. Fall semester starts in about a month. I can't even believe I'm saying that. This year's gone by so fast and the summer's gone by so fast, but nonetheless the second week in September is fall semester. And for those of you who have always wanted to take that diet and lifestyle intervention course, it's always kind of expensive because of the celebrity instructors, but we're offering it this fall for a much reduced rate. Same information and content, same CMEs and CEs, just our regular institute staff instead of the celebrity instructors. So take a look at that, and then we have a great package deal to do our 4 most popular courses, and you can save over 50% on the tuition if you sign up for the package. So if you want to talk about that, send me an email at pampopper@msn.com and we'll set up a time for a phone chat and see what, if any, of our programs work for you. All right, a couple of interesting things to talk about today. The first one is thyroid function. I've been talking about this a lot lately because, as it turns out, there's a lot of misunderstanding about this issue. And today I want to talk about iodine because the role of iodine in thyroid function is poorly understood. And while it's true that iodine is necessary for thyroid function, I think that we're overestimating the amount of iodine that people need to take in. All right, so here's the way that it all works. The thyroid gland extracts iodine from food in order to make thyroid hormones, and it uses about 150 micrograms a day. Now, just to put this in perspective, how easy it is to get this from foods, and I don't think most people think, everybody thinks iodized salt is the place to get it. They don't think that food contains it, but actually just a half a cup of navy beans has 32 micrograms, a cup of fresh strawberries contains 13, and a medium baked potato is 60. So if you add up what somebody like me, or if you're eating like I do, eats on a daily basis, it's pretty easy to get enough. In fact, according to the National Institutes of Health, average iodine intake in the United States ranges from 138 to as much as 353 micrograms a day across all age and gender groups before considering the iodized table salt that people take in. Now, the problem is that while some is necessary, more is not better. And one of the problems we have in nutrition is the assumption that if some is good, lots more must be better. And that's really not the case in many cases, especially with iodine. Excess iodine can stimulate production of antibodies and lead to hyperthyroidism, hypothyroidism, and Hashimoto's thyroiditis. So people should be cautioned about the risk of consuming too much iodine. And iodine supplements, while commonly prescribed, are really contraindicated for most people. Now, in a study of 146 Korean patients with subclinical hypothyroidism, and this was defined as TSH between 4 and 20, and in other countries, by the way, the diagnostic parameters are very different from here. We ratchet down those diagnostic parameters so we can put more people in the sick category. But anyway, in this population of 146 Korean patients, those with urinary iodine concentrations of 300 milliliters were urinary concentration of 300 milliliters or more, were instructed to restrict iodine-rich foods. And after between 3 and 6 months of follow-up, those patients who showed sharp drops in urinary iodine concentration also showed sharp drops in TSH levels. They went from an average of 9 down to 4.7. Their T4 levels went up also. For patients whose urinary iodine concentration didn't change, there weren't any changes in TSH or free T4 levels. The researchers concluded, and this is their direct quote, iodine restriction may normalize or at the very least decrease serum TSH levels in subclinical hypothyroid patients, and serum TSH levels are strongly correlated with urinary iodine concentration. So when you think about the number of providers who are recommending iodine supplementation for subclinical hypothyroidism, they're most likely hurting people more than helping people with this. So it's true, now people get confused about this, that iodine deficiency can lead to goiter and hypothyroidism, but the risk of iodine deficiency, I think, has been sharply overestimated, particularly in well-fed populations like in the United States and in other westernized countries. Significant numbers of people in cultures like this probably have more risk of overdoing iodine, taking in too much rather than taking in too little. A lot of particularly holistic and naturopathic practitioners recommend iodine supplementation as part of a treatment plan for hypothyroidism, which in some people can worsen their condition, as I mentioned earlier, and even cause permanent damage to the thyroid gland. And so I'm not saying never supplement with iodine, but I would sure want to see a food journal to look at iodine intake before making a decision about that, and it should be done really cautiously. And again, I alluded to this earlier, but we keep changing the diagnostic parameters for disease diagnosis in this country, which is great for doctors and drug companies, not so great for patients. So before you agree to any form of treatment, iodine or anything else for thyroid disease, make sure you really do have it. As it turns out, probably 25 to 33% of the people in this country who have been told they have hypothyroidism actually don't have it. So that's what this informed medical decision making that we do here at Wellness Forum Health is all about, finding out the truth about this stuff so that you don't get sucked into the medical mill. All right, so before I go on to the next study I want to talk about, we have to have full disclosure, and here is my disclosure. I love yoga. Wellness Forum Health owns a yoga studio. I think yoga is beneficial, or I wouldn't do it all the time, and we certainly wouldn't have a yoga studio in our facility. So personal feelings and bias aside, for a very long time, people have reported that they've benefited from yoga in many ways, myself included, ranging from improved concentration and sleep to resolving sometimes very complicated musculoskeletal issues, and that was the case in my situation. I managed to exercise my way out of an injury that was pretty severe. Well, a growing body of research is confirming that these reports aren't just stories. There really is something to this. Regular yoga practice improves health in significant ways. So according to a 2014 systematic review and meta-analysis, yoga improves markers for cardiovascular and metabolic health, and the effect of yoga on cardiovascular health is similar to that of aerobic exercise. Researchers identified 37 randomized controlled trials for the systematic review and then 32 randomized controlled trials for the meta-analysis. Now, some of the studies used non-exercise controls like relaxation or diet alone, and others compared yoga to specific forms of exercise like aerobic exercise, physical training, cycling, running, that kind of thing. Compared with non-exercise controls, yoga significantly improved primary outcomes like body mass index, systolic blood pressure, and both HDL and LDL cholesterol. Secondary outcomes improved also, like body weight, diastolic blood pressure, triglycerides, heart rate, and smoking status. So apparently yoga even helps with quitting smoking. When yoga practice was compared to exercise controls, improvements were similar in both yoga and the other forms of exercise that those exercise groups were participating in. Now, the researchers cautioned that the sample sizes were small, and that's usually the case in these kinds of studies. Some of the RCTs were of moderate quality, but they concluded that yoga can reduce cardiovascular risk and that traditional aerobic exercise is not the only form of exercise that is effective for doing that. Now, we've always encouraged our yoga students to not only come to yoga, but also participate in strength training and aerobic exercise, but this study shows that yoga deserves an equal place at the table in terms of exercise modalities. And in addition to the benefits that were outlined in these in all of these studies, I would add that yoga improves balance, coordination, strength, stability, flexibility. And a lot of us would report that it improves our mental health and focus too. In fact, I've always said that when I go to yoga regularly, I'm a much nicer person than when I don't. And once in a while, when it's really, really busy here at Wellness Forum Health, and I'll be waffling about should I go to yoga or should I stay at my desk and get stuff done, a lot of the other staff members here will say, no, you should go to yoga. You go right on ahead. We will be fine, because they know I'll be a much nicer person when I come out of that yoga room than before I go in. So anyway, I wholeheartedly recommend yoga. If you haven't tried it, do it. There's a type of yoga for everybody, every body type, every injury that any of you might have. There's hot yoga, there's cooler yoga. I even heard there was naked yoga in New York. I don't recommend that, but we'll put that one aside, and I'll encourage all of the other yogas. How about that? All right, that's all for today. As usual, pass this on to anybody who you think might enjoy watching it, and I'll be back to you Thursday with more news.